Day.
Greetings.
Okay.
Twin Day, brother.
Twin Day. Let's begin.
Welcome to Rejected Stone Podcast. My name is Zebulon Maletsky. Want to welcome everybody. We're just getting this started. We're blessed today. This is our maiden voyage, our first episode.
Sir.
I want to introduce my partner, Dr. Jarvis Watson, on the line.
Peace and greetings, everyone. Peace and greetings. Man, I'm feeling excited about this Nargles at Maiden Voyage. We've been talking about this for about like a year, Doc. So it's good that we were finally here, and hopefully this, like I said, is the beginning of many more. So lead us in, my friend.
Yes, sir. Well, I'm glad to do so. So we want to just welcome everybody that may be joining in, everybody may be looking at this. We talked to each other about this, and we decided we're going to start this off today, this 1st of May, May Day.
Yeah.
We got some issues to talk about. We got some issues to talk about humbly as a community, coming together, and the team here has got a report. And so it's good to be in dialogue, family. It's good to find a way to communicate in the midst of the times that we're living in right now.
Yeah.
And so we're pleased to be able to bring this message, imperfect as it may be, in these times. And we have a lot planned for you today. A lot planned, don't we, Doc?
Man, we got like a whole heap of things to talk about. But I think, like you said, it comes from a lot of discussions that not just you and I have been having, but discussions that we've been having with family members, friends, loved ones. And we're trying to do it in a way of not just bringing you the information, but I think from a place of humility, and I think for us, a place of care. And definitely want to share some stats with you, but we just want to share some of our thoughts with you today, because that's, I think, what's really on the minds of a number of people, not just statistics and the projections, but like how are we feeling, how we progressing, and hopefully we leave our audience with a sense of hope, a sense of moving on, and a sense of accomplishment. Because you know what, this is not the first time we've been through some type of crisis or form of oppression, and but that spirit what we're trying to like bring through today is a spirit that has brought us through all these other generations and years. So yeah, man, I'm really ready to connect with you. And I think the way we dialogue, like on the phone or in person, I think the fact that we can bring it to the people right now, I think it's going to be a dynamic conversation. So, and we're also looking for people to give feedback, because we're going to be sharing this on YouTube and other platforms. So we always leave a chat function to let us know. Like I said, this is for you all, and we're just asking, God to kind of use us as vessels and to bring this through. So yeah,
that's right. And don't forget to hit that subscribe button.
Yeah, man.
That's right.
You gotta let them know where this is being brought from. Yeah.
That's right. But now, all jokes aside, I appreciate those words. I appreciate the words. I think we all do in a time of crisis, in a time such as this. People have decided to be brazen, to be bolder, bold as lions, and speak forth and try through a partnership that we've had that has helped us to see through some things, help other folks see through some things, and just be in dialogue to bring it to this forum, and do the best we know how. To be a resource.
Yeah.
Okay, to be a resource, be a lifeboat. Folks are hurting, and so that's the kind of thing that we that brought to bear this moment of going live here and being with you. So we thank you. Yeah, we thank you. We as my compatriot said, we have a lot planned. We have a stack of things
Yeah, man.
before us. Not all bad news, and there's some hope. That's the other part I think that we want to, you know,
Yeah.
hopefully bring with our program today.
Yeah. Just to kind of
Safety.
understand,
Yeah.
like,
Yeah.
what does safety mean to us right now? Yeah.
Right. No, I think I know what you mean, and it occurs to me that that is, you know, on a lot of people's minds right now, and it was on our minds, and we, um, in our dialogues, in our planning for this conversation,
Yeah.
we talked about themes. We talked not themes, but what's on our mind. You
Right.
know, what are we feeling right now, thinking right now? There's a point where you need to seek some humanity, and try to keep body and soul together. And so we were talking about it and saying that the idea of safety. What does safety mean right now? What
Hmm.
does it mean to be safe in this age of COVID-19? In the age of not an age, but in the midst of a pandemic. Okay,
Right.
what does it mean to be safe? Um, what does it mean for for Black folks? What does it mean for Black men? What does it mean for Black women? What can it be meaning? And what are the differences in terms of what makes the difference?
Right.
And these are some of the things that we're, you know, been dialoguing and talking about. Doc has some numbers, and we have some, you know, reports in terms of what we're learning through our network, and we feel grateful to be part of those conversations.
Right.
About the health disparities, for example, one of the issues I'm just our lineup. One of the issues we're going to talk about is health disparities in Long Island. We have resources coming from Black Long Island, and we're going to be hearing about that. Um, Also, you know, what do we know about some of the rumors that are out there, and things that people are hearing, myths, essentially.
Yeah.
What's myth? What's reality? We're turning on the news. We're not getting, it seems to me, a complete picture that's particularly useful for the demographic that we're talking about today.
Right.
So, and at the same time, we're talking global. We're talking humanity again. And then lastly, we're going to talk about the book a little bit, medical apartheid, and some resources that we have come across. And between that, various other things we may have as we go forward. We're looking to have folks call in and stuff. And so today we present some of these issues based upon the research and time. And so, Black during COVID-19 is the title of this show today. What does it mean to be out there right now? If you can't use the bathroom, if they're shutting water off as they have in Flint, you can't
Mm.
wash your hands. Okay, we
Yeah.
need a Black Red Cross right now to save
Oh,
some folks. So you know, we hope that it hits ears, and we move forward.
that's the first time I heard that, a Black Red Cross. But like I said, it's not the first time where we had to kind of pull together resources and kind of own the narrative for some things. But I think on that aspect,
Yeah,
yeah, that safety, like,
and we're realistic about what we can't do.
yeah,
You know,
yeah,
what we can do, what we have is we've gathered some of the information, and we're going to be sharing some of it today. Okay.
yeah, man. So I think it's always good to start off with some numbers and to really talk about where we are. Actually, some numbers are actually pretty good. I was watching News 12 in Long Island, and Steve Ballone, the county executive, was really breaking down some numbers that are actually not too bad. But I'm also going to share some other things that kind of balance out like what we're looking at. But as far as hospitalizations, they're below 1,000. Was like a decrease as of April 30th. 77 people less have gone into the hospital. There was a peak at one point that was at 1658. Well, 1,658 people were actually hospitalized in Suffolk County. And we know about some other locations that they've had, like even at Stony Brook, they've had like a makeshift hospital, and even at Jacob Javits Center, they had a makeshift spot there. I'm understanding that they're like down to 8 or 9 people right now. Confirmed cases in Suffolk County. And for people that are listening, this is really within the context of Suffolk County. 34,802 confirmed cases. There have been 22 additional deaths, and which makes a total at 1,177. But there's been a decrease of people going to ICU, which is great. And then 114 people have been discharged from hospitals in Long Island in the last 24 to 48 hours, so to speak. This is as of April 30th, 2020. But the thing that's that, like, once again, that's you can see that we're kind of coming on the other side of that bell curve, so to speak. But the things that are concerning when you look on the map, the county map of who's being hit the hardest, it tends to be these areas where there are people of color, historically underrepresented groups, those who might be considered undocumented. And it seems to be the same counties that we talk about when we talk about disparities, not just with health, but also with education and transportation and all these other things. So we have places like Brentwood, Bayshore, Central Islip, Coram, Wyandanch, Deer Park, Dix Hills, Amityville, Huntington Station, Dix Hills. I think I said that twice, but even I think I saw Comac in there, and I'm not, usually that's not the historical locations in Suffolk County towns, but there's this narrative that keeps happening in regards to who's being affected the worst, and could be all kinds of reasons behind that. My wife, who works in Office of Minority Health, talks about the fact that there's some things called comorbidities, that historically there have been some health issues that have been existing with certain groups, like diabetes, hypertension, sometimes some
right. It's so-called the pre-existing conditions.
Right. And I think that the fact that these communities have been hit, and they were the last ones to actually get some people out there testing what she's out there doing right now, it's this narrative that we are kind of hoping that in the future we don't have these same conversations when we talk about these areas, which I've been privy to be in and out of on certain times. There's some great people in there. There's some great initiatives that are happening. There's some really communal kind of activities that really bring a lot of pride to people who come from these neighborhoods. My wife's been on panels. I've been in the audience. I've known a lot of these community leaders that do a really great job of making sure people are feeling safe. But now that we have this COVID-19, like I said, you talked about it before, there are a lot of myths, misinformation. Sometimes things are misguided. Sometimes things are really true, but there's really sometimes really not enough experts that look like us to kind of validate, are these things that you should be worried about, or some things you can kind of push to the side. So we, like I said, today we really want to share some more information about what's really happening that's positive in these neighborhoods, that we can at least put a hat on that and say, hey, at least with all these things going around, there's some good things that are happening. So that's the news from the streets, so to speak.
You've been part of some conversations that you have been part of the team that for the architecture for some of these dialogues, or many dialogues. There's many dialogues happening on the island right now that I'm hearing. But the one you all have met already. I was saying you've assembled a group. You're working with a group now.
Yeah. I'm glad you brought that up. Yeah, there's a number of people doing some things. I want to give some people some props first. Soberly, State of Black Long Island has really been putting out some great webinars and things on the Black churches and Black economics. I think it's coming up in the next series. Working with, I just really connected with minority millennials that are constantly having discussions about the conditions of underrepresented folks, really from a millennial lens, but really talking to a lot of politicians, a lot of local people, not just in Suffolk, but also in Nassau as well. And I really, a big shout out to Teresa Sanders and Dan Lloyd out there, really making the people understand what's happening. And then with this thing that we're trying to do is really create a collective approach to sharing information with the people, which is called Trusted Voices of the Community. And what that is another Zoom chat, another opportunity to kind of get people together virtually, but it's bringing all these people like minority millennials, SOBLE, LGBTQ leaders, but those that work with people in domestic violence situations, healthcare, educators like ourselves, but also in the K-12 sector. Also looking at educators within the 2-year colleges and things like that. So there's, I can keep going on and on for a few days, but there's some messages that need to be sent out, especially for our people out in East End. I don't know if people tend to stop Suffolk at Stony Brook University, but if you go beyond Suffolk, we go into Suffolk a little bit deeper, you have those who are indigenous people from the Shinnecock Ungachuk. Then you have some other folk who are undocumented. And then you have our historically underrepresented folk from Black, Latin, and Latinx neighborhoods or populations that are out there as well. But sometimes their stories aren't heard. So we want to kind of bring some of them, their experts and their leaders to the microphone so we can kind of spread the news about what's happening, but also sharing them. And I think this is what my colleague Retha Fernandez, who's a CDO of Suffolk, really emphasizing not just the sense of hope, but also some steps, some best practices that people can bring home and back into their neighborhoods. And I say, hey, I just got off this call. And then we also have this research that we're looking at that can really help our condition. And we probably have more than we know, but we still need to kind of advocate for this particular area. So we're looking forward to that. That should be coming up on May 14th. So just a little plug right there. So, yeah.
Yeah, no doubt. Thank you. I mean, that's what we're here to do, is to spread that information and get the word out about stuff, and on the grapevine, or out there, just it's whistling through the wind,
Yeah.
think about it, and catch wind of it. I'm involved in it too. I'm hoping to really connect with it, because there's so much happening.
Yeah.
There's so much happening. There's efforts happening on my end over here in Brooklyn, in the city. There's efforts happening in Bedford-Stuyvesant,
Right.
and so it gives us, we have the full breadth of, because Brooklyn is in Long Island, is on Long Island. So
Respect.
we have the full breadth.
Now if you put this, bro, if you put this on, I'm pretty sure there's going to be some people like, what? There's going to be some interesting comments. Geographically, geographically, you ain't lying, brother. So.
Okay, yeah. So we'll leave that, maybe. But yeah, nah. But I mean, I seen that with, like, the map. No, but it's cool. It connects. It should connect, and that's what, we get more coverage that way. And that's, if only for nothing else, we're racing it back and forth. And as you mentioned, like East End too, we don't forget that. And that's always, a concern with so many things happening around. Because I think, there's coming a point where it's going to be time to coordinate different, efforts.
Definitely. Yeah.
Increase the strength and the power of networks, just through even word of mouth, because I can tell you, over here, in Bedford-Stuyvesant, I don't live in Bed-Stuy, but I live near it. I live in Bushwick, which is right next to it.
Right.
But the who gets tested, where one can get tested, the sites are sparse and spread out and hard to access for folk. And it's just, I think it's been widely reported in the news and in the local news and around.
Right.
There's rules that dictate who is eligible for a testing site. There has to have been, I don't want to misquote it, but there has to have been, if my understanding is correct, a certain number of people already infected in an area before they will place or set up a testing site. Right. And that has meant that there's really not enough of them. So I'm hearing that's going to change. Silver lining, again, hope. I'm hearing that's changing. Efforts underway. Churches may be opening testing sites.
Yeah.
So that will help. That will help a lot on this side. You know.
Yeah, I know we had talked earlier about the whole change of like the secular kind of situation and the religious populations of communities really coming together now. At one point, you know, like I said, there's some things that I've seen even with the Office of Minority Health in Suffolk County, really using the churches to give weekend webinars or weekend seminars on how to eat healthier and how to do things a little bit healthier, anywhere from hypertension, mental health. We just did something recently with mental health as well as physical health by bringing in trainers and Black therapists and things like that. But now we have a situation where the community is coming together for these serious health issues. And at one point, I think you had brought up medical apartheid. That book kind of talks about things like the Tuskegee experiment, where African Americans were used as test subjects with syphilis, and were told that it was something else, and they weren't really being educated on what syphilis was and what they were going through to realize that they were actually being used as guinea pigs. And that is in our IRB trainings, a lot of inhumane like treatments and ethical trainings that we get through all our things like that. And the fact that now it's coming to here where we have to kind of put faith into those medical folk and those that are on the front lines that are really trying to help us. Now it's like this barrier is being broken. And the myth of the big bad medical person coming into the neighborhood, there has to be this sense of trust and connection, community, because if they don't come through and don't produce a test, and that means the likelihood of life within this community will go down. And I think that the fact that not just the governor, the president, and the faith-based organizations are really coming together to provide this safe space for not just in the parking lots, but also within the sanctuaries to get this testing. I think that is key. And I think that's something that hopefully we can model and build upon moving forward. So.
Yeah, well put. Yeah, absolutely. That's right. And so yeah, we had talked about just how, again, it has been a difficult ordeal. We're living through times that feel unprecedented, although we know that there are historical, precedents for this. Folks have made it through not only actual pandemic of 1918, but racial pandemics,
right,
and historical pandemics, and a lot of different things that have had to move through. And so we're living in very unique times, to say the least. And it's kind of like as we begin to cope with this new reality, and rethink problems that we thought we knew and understood have now just been, of course, exacerbated and also agitated, for lack of a better word. There's pre-existing conditions that are also structural in this country,
right?
That are making this a fight that concerns African Americans specifically, Black and Brown folks specifically, because we're seeing it's being reported in the national news, being reported everywhere. These, the discrepancy in terms of African Americans, about approximately 13% of the population, but we're seeing rates as high as 43%,
right?
High, rates as high as 70, up in the 70%, and if I understood, in Louisiana. I saw an article in Newsweek that said all of the deaths in St. Louis were African American. I didn't even have time to follow back up to make sure that was actually true, but that's just Newsweek. So I'm assuming something's happening there. So you know, I guess that's what, the cost, comes down to. And churches, as you said, are stepping up. People are, yet is finding their voices. New generations of leaders too.
Yeah, and I think that being that we are so, man, you made some great points to the fact that there's this like I said, there's either a myth or there's a fact. There's some data out there that kind of paints this picture of, is it that we're doing it to ourselves, or there's something happening to us that we are having these high numbers where we may not be
Whoa.
getting all of the uh, cases of the COVID-19, but are we dying more in higher numbers based off of this? And this is like, well, what is it that's preventing us from getting to these particular places that can give us help? Are we not getting enough information? Are we not going to some of these medical facilities? Are we able to get to some of these medical facilities? Are people kind of like hesitant because of some of these myths that are flying out there regarding, well, if you go to the hospital, and I've seen YouTube videos just now, not just even going back to like 1918, but like now, like people's family members go into the hospital, and you have enough people saying, don't send them to the hospital because it may not come back out. So
People
I think,
feel that way. Everybody's just saying that.
yeah, I've had hospitals even where I grew up that have certain names attached to the name of the hospital, because if you go in, there's a possibility that you might come out with something or something. There's this fear of like the medical folk don't really have your best interest at heart. But you have, once again, the faith-based organizations such as like the Baptist churches or the AME churches that are really connecting with the people, saying, hey, we still going to do some things virtually. We're going to do some things that are inside the sanctuary, so you actually come back into the building. And when you get there, hey, we're going to not just take care of your spiritual health, we're going to take care of your mental as well as your physical. So I think it's important that there's this accountability that comes along with the Black churches as well, and other Latinx churches, Muslim church, those that follow Islam, and those who identify as Jewish, that really have this connection with the medical facilities and the medical centers, and sometimes even our universities, to make sure that say, hey, we matter. Here are the things that we need, and we're not just going to stop with COVID-19, but these are things that we want to kind of create this platform to say, like, we care about each other, so let's do this, not just with this disease, but everything else that comes along with the comorbidities and the historical legacy of just not getting the right treatment. So, yeah.
Yeah. Well said. I mean, it's like we need. I think you put it this way when took a little while, but
Yeah.
took may it take too long, but 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 at least one possible silver lining to the time that we're in, or not a silver lining, really more a just a takeaway of a note of positivity, is that there is now more attention probably being placed than there has been.
Yeah.
I have seen, the concern seems there. The resources are mostly, well, we're here in New York, so
Right.
that too, and so there's a lot of moving pieces, but generally speaking, people seem to be getting the issue, I should say, seems to be getting more attention. That's for sure,
Yeah.
and that can only be a good thing.
Right. Yeah. So I'm definitely happy to see more of these things happening. And what we can do, like I said, in addition to our videos, we can actually kind of share some examples of what's been happening and some articles that you can actually see. So we're not just talking about it, we could actually drop some science on you as well, because I think it's important that, like I said, we just not bringing hope, but we actually bringing facts and truth, which is part of what we're trying to do through this podcast right now. I think another thing we brought up, to switch gears a little bit, and I'm really curious about this as not just somebody who's married, but also married with children. How has COVID-19, I don't know if I can just say it like this, like what positive things have come out from you all having to be home and even being in the educator role, not just with the student you work with at Stony Brook, but also with your kids, you know, and your wife having to take on that role as well. So.
No, right on. Yeah, I mean, it's you know, that's the realness of reality right now. It's you know, I joke with my students because sometimes in the middle of class, we've all been going through this, but you know, they can hear the kids arguing or way too much information about a particular video game that no one needed or wanted.
Right.
They can play all the codes to the Avengers. They've heard it all in his
house. Man, it's probably helping them out. Like, oh, thank you.
yeah, and so, you know, but no, we dig it. Like, you know, we kind of keep it open like that, you know.
Yeah.
And yeah, I mean, you know, that's been, you know, just as a person, you know, personally, I think, you know, and I've talked to a lot of other people, and they say, yeah, I had a time to kind of slow down a little bit, you know, think about some things. You know, everyone is a work in progress, you know.
Yeah.
Like, there's always things that you can, there's always room for improvements. There's always room to learn and take time. And so, you know, I think like everybody, that's been how it is, you know. Thankfully, we're really lucky,
yeah,
you know, in that respect. You know what I mean? Because not everyone is able to work from home. Not everyone has a job where they can do it over Zoom. I end up having a job, talk to me, that actually, you know, not that it's not easy, making the jump, although it's been pretty good for us. For me, I mean, it's been pretty good. It hasn't been bad. But anyway, so we're lucky. And that's how we feel. So we, you know, we went through all the phases. We watched Netflix, you know, we did that. We talked to each other, you know. Certain people were trying to learn piano. I'm not going to say who that was.
Ooh, okay, all right.
It may have been the kid. It was me.
Like I said, I got that bass.
Well, give me some time on that one, but I'm working on it. I got the music, a lot of music. You know, we've been playing. My son plays violin. He's with the string instruments. He does guitar. He strums guitar a little, and I'm anyway. So I'm happy to report a lot of good things.
Yeah.
We come out of this playing in a band. Maybe we be a family band out here. It's a possibility. I'm not gonna say it's not gonna happen.
Listen, man, you got all types of families. You got the Jacksons. You got the Partridge Family. You got you got the Jets.
I believe.
You know, got the Barges. You know, but all the stuff they went through, they were still like out there killing it. Yeah, man. So you never know.
Right, we could be the Barges out here in this situation.
long as you won't end up on Unsung, man, you good, man.
Man, see, out of your word, you know, watch this clip end up on Unsung.
Oh, like, oh shoot, like remember that time the Dropper said it? Yeah. But
hey, man, you know, Unsung's brought back a lot of good music. You know, if Unsung, if you're watching, we're available.
Yes.
But I'm just kidding. But nah. But yeah, no, man, no. In all seriousness, like, yeah. It's you know, it's really brought me closer. It's brought me closer to the family, to not the family, but you know, to family. Just spending that time, and I you know, treasured it. We don't have like a garden or anything. That would be cool.
Hey man, we got plenty of dirt out here in Long Island, man. So come on out if your kids ever want to take a road trip and field trip. My seeds are starting to germinate and come out the dirt. So it's pretty exciting too to actually see them starting to come up. So it's not just a science experiment; it's also just something to take your mind off of all these other things, but also is to keep your mind on the fact that life still goes on. You know, there's still hope and opportunity out there. So. Yeah,
man, that's right. And a lot of people are doing gardening. I'm digging, like, I mean, my friends and I don't know, people that I know, you know, they're doing that kind of stuff right now.
Right.
They're focused on getting, you know, the levels right in terms of the gardening thing. I need so much mineral. They got concerns about soil and stuff. I'm like, listen, sunlight, water. That's what they told me. I don't know.
Taking it to another level, man. It's like, you know, when you're not running around so much, now you got the time to kind of like, oh, what's up? What other components are there? You know, um,
Yeah,
like I said, like
that's it.
you got an instrument, I got an instrument. I haven't touched this thing in a long time, but now that I don't have anywhere to go, really, it's like, all right, what can I learn and through YouTube, and how can I use this technology as a tool as opposed to just a distraction now? I think we had talked about that before, like even Denzel Washington talked about that. Like I saw a clip of how people are becoming slaves to the technology, but now this is more of a tool to kind of help get the word out. And how many other people like ourselves are thinking about doing podcasts and Zoom
Yep.
meetings, and I mean, I think it's more of a necessity now, especially in our realm. It's like if you don't know how to use technology, then you're gonna be out there. But I
Yeah,
wonder how
that's
the
true.
yeah, I wonder what the situation is like for those who do not have access uh, to get to these type of forums and these type of discussions. Like, how do we get the information out to them?
Yeah,
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 yeah, because that's what I'm concerned about. You know, because I work with a number of students on campus that we actually have a fund to kind of help with either technology or helping with some financial support. And you hear almost the same way, like you said, them peering into your house. We're peering into their houses and their lived experiences, and really
yeah,
trying to understand, like, wow, you're going through all this and you still have enough of your faculties to talk to me and articulate yourself in a way that kind of help tell your story. And where I, you know, for most people, you might just kind of like bend at the knees and not want to get up in the morning. But how are people faring out there? And then, like, what can we do as leaders and as educators to kind of get more of their stories to the table, but also more access and more resources, get them access to more of these resources that are there as well. So, yeah.
yeah. Absolutely, no, absolutely. That's where we are now. I think that's the phase we're in this struggle, which is by no means over.
Right,
Right?
right,
It pivots, and in fact, I will go as far as to say it's just beginning, because if what we're learning is true and what we're seeing is true, just in terms of even how long this pandemic technically is lasting,
right,
um, it just takes on particular importance because those numbers are so high. And so the good news is that people are activated, they're organizing,
yeah,
they are one other. Speaking of good, of things, interesting things that have come out of this that you might not have thought would happen, right? It just didn't occur to you, like, but people are seem that much more motivated to do and to try to make the connections, make the link up, like we're doing. Not just it also coincides with the moment in technology that makes it possible. And I have been, I know, you've been in, but I've been attending really interesting webinars um,
yeah,
through various invitations and so forth. That it's nice to be included in the conversation, more to listen and really to learn, honestly, or mostly listening, and then also some other stuff. But really to listen and learn. We did the Virginia branch, the Richmond, Virginia branch of the ASALH, ASALA,
right,
Association for the Study of Afro-American Life and History, um, did a webinar on Sunday on, it was called COVID-19 and Black mental health,
right,
basically,
yeah,
right? And so, not no, just in terms of mental health, and it was eye opening. People sharing knowledge that people need to know. People have questions. There's myths out there in the news itself, um, about what causes it and everything else. So it is important that folks be in dialogue right now, and just try to through testimonial. Well, I saw this and heard this. Well, I saw this and heard this too. What is happening? And then with in terms of our leadership nodes, Urban League is out here. Asala is working on things. The NAACP is most definitely out here and involved,
right,
and and our civil rights organizations are reinvigorating momentarily, and it's very interesting. All of this is an interesting moment.
Yeah, I know that. Yeah, we definitely are active out here. I get emails all the time, and like I said, these are things we can share with you all as well. Some links to some different great people who are doing some great things, and I know one in the education realm. Oh, peace out to NAACP and all the different areas in Suffolk and Nassau, and we can't get Nassau out there, but they're doing some really great things out here. Hopefully, we can have some of them on maybe in another show to really have the conversations also about not just hearing from us, but hearing from the people that are out there in the trenches, beating the street. And quiet as kept, y'all, they also are full-time professionals for making sure that they do their job in the community. So this is like, once again, this legacy thing we talked about, that's them making sure they carry their torch and hold that thing high.
Yeah.
I'm not sure if you understand, even in the higher ed realm, there's been some great webinars. I'm looking at some things right now, some of my notes, but Dr. J. Luke Wood and Dr. Frank Harris have had a number of different webinars on like inclusive engagement with students, some as through the eyes of administrators and student support teams, as well as faculty. And being a faculty member yourself, this could be like a daunting time to kind of have to transfer everything over to online teaching, some hybrid action, but for some, they may not be having such a great time, but also you having to switch up not just the way that you deliver the information online, but how you deliver their information online. So they're really talking about a lot of different ways of how to be more inclusive and making sure that these practices are not just about the teaching of the information, but also how the community needs to be developed with on this online version. And they talk about a couple of different ways of like being intrusive, being a little more connected to the students. But two things I think that stand out is how to be more flexible and compassionate in this time, as well as being community focused. Like how do you create almost, I won't say a balanced playing field, but how do you create more of a level of engagement or opportunity for there to be dialogue back and forth, as opposed to maybe some of the traditional ways of us being the experts and people sitting on top of the hill talking to the masses. Now it's like we're facilitators now, and really being able to connect with students and having them kind of tap on some of those critical thinking skills. I see you biting at the bit to say some stuff too. So I know as a faculty member, how has COVID kind of maybe modified how you approach, or has it enhanced some things that you do? Yeah.
Oh yeah. Interesting question. Yeah, of course, like everybody, it's just, I mean, the report is good. It's kind of made me be a little more creative about some of the stuff. The class looks much like what you see right now.
Yes, that's cool.
You keep it 100 right here. This is it. And it's been cool. It's been a chance to be innovative, actually, a little bit. Do some things that I didn't know we could pull off.
Right.
Try some things that I probably ordinarily would not have tried to do. Mm-hmm. Having group discussions, basically running up feels like a webinar, during class time. And tips. I've learned a few tips, plan ahead, really take that time window seriously if you're doing live teaching, which mine is. Have office hours if you can, because folks are hurting too. Your kid, the student, not your, but the students are going through things. You know what I mean? So you want that avenue to try to keep the channels open. Basically, simple, common sense. Keep the channels open. Be compassionate. Try. There's a lot of things that can't be solved, but some things can be solved. And so that's basically has kept things good. And I say that because the weird thing is that the class is somehow good, still been good.
Yeah.
You know what I mean? It's just
Right.
still been, in fact, stronger in some ways.
Right.
And so it's working. You know, it's working. Now, there's things you worry about. You can't control things on the other end. How people are coping or faring when you don't have eyes on. All of these things are concerns. But I mean, like you started off the show saying, they had built a temporary hospital on the campus. If all that can be going on, I can do this. I got part. I can
Word, man.
do this part.
Stay in my lane.
And
That's a lot. Yeah.
everybody's been. I feel like that's how it's been. Everyone I've talked to is like trying harder, giving more. Going that extra route. And so that's one interesting kind of like positive thing of this time that I've been noticing. For the most part, it's certainly done that with me with the teaching.
Right.
And just grateful for a lot of things. Like I said, you have steady Wi-Fi. Hello.
Yeah.
You know what I mean? A lot, folks don't. How do you? It's and there's been. I have to also say, last thing, there's been efforts, major efforts. I know people who teach in Brownsville. Everybody got a iPad. Every student did. Now, did it come on the first day? No, but they got there. Then they got there pretty fairly soon and given. But then there's the startup cost. The digital divide is killing us too. That's been ongoing. There used to be this guy Kenny Granderson, who's actually from Brooklyn originally, but I met him in Boston. And I think he's back this way now, but he used to work on the issue of the digital divide in a major way up in Boston. And so if you don't know how to use it yet, how do I connect the upward curve in terms of, the challenge curve in terms of just learning how to use the technology then you can do, Johnny jumped over the wall with, you can't get to the lessons, especially with the little ones. Right. That's a big issue. We can do a whole show on that one, but
always come back, man. But I think, like I said, these things that have been existing for such a long time, and you might have heard these terms like digital divide or prison pipeline and disparities, and now these things are really having a tangible manifestation like in our lives right now. Like these are things that are not so easily to overlook, because guess what? It's not just Brownsville going through it. Now we're looking at suburban places, more rural places, and even the places in the city. And like I said, COVID does not discriminate. You talk about a myth. COVID is right. Everybody. But to really, I think even up for us as educators, really being able to kind of like, all right, now that you understand what we're talking about, let's amplify this and let's like talk about this even more. But yeah, man, it's like I said, it could be a situation where it kind of like breaks your heart, and it does in some aspects to hear these type of things. But like I said, if we are in a place that we have the privilege, let's make sure that we get this information to other folk to keep talking about it a little bit more. Like I said, this is just our first podcast, but I think as we start getting things cooking, man, we want to bring more of these situations and not just to look at the magnifying glass and look at it, but also to kind of step back and say, okay, now that we know, get these people what they need, man. So yeah.
Well, that in that spirit, I have one other sort of piece that's good. In preparing, for the discussion, we came across this the project that Ibram Kendi, folks who know his work on anti-racism and anti-racist education. He heads up this center at American University that's looking at this, and so he's the founder of the Anti-Racist Research and Policy Center at American University, among other things. And so they're looking at COVID racial data tracker project, COVID racial data tracker project that he's been talking about on news media and other things. And so, they've made a major shift in terms, of focus as they proceed in their work and in their research, I should think that numbers will be coming out of that center as time goes on that may become very helpful, in terms of really like good numbers that really can isolate in terms down to where, down to, congressional district, down to counties, down to wards, down to streets. We need that kind of level of racial. So it's the Racial Data Tracker Project. How many tests are there available for folks? How, are Black folks being tested in the ways they need to? Can they find that information? So that we'll have more. I'll have more on that one. That's just in process, but I'll have more on that, in the future, as we continue, to discuss this, and they're going to be doing some really important work.
Yeah, man. So I think that I was just watching the news today about the test, trace, and track kind of initiative that are happening now, even with Johns Hopkins University, really working with the QEs and the SUNYs. So it would be amazing if we can, like I say, get some of that data and then see what's happening with the Bloomberg kind of approach, and to really start to once again bring some of this data to folks, so we don't have to keep going through the same thing each and every day. So hopefully, we can help people understand about, not just understanding more about like how viruses travel, but also about what can we do now to make sure we're more strong, not just as a community, but also personally. Like, what are we eating? How are we living? Are we treating each other the right way? Are we allowing people to treat us a certain way? Are we being more connected? Like, just going back to minority millennials, I love what they're doing, because they're bringing more of the faces and the voices of our local officials to the people, holding them accountable as they're like, I voted for you, or maybe I didn't vote for you, but since you represent me, I need you to speak on my behalf. Yeah. So
you're doing good work out there. Yeah. No, it's exciting, and that's critical. Have to intersect generationally. Have to be in dialogue with one another. Have to be informed. Have to have sources of good information.
Right.
We need fresh water. We need it flowing in every city. We need soap, available to those who may be living, on the streets. We need a lot of things in terms of just basic human dignity today, and so that's a right that, here we are again, and amazing to me, at least, or maybe I shouldn't be amazed, but this whole long, arduous struggle over water in Flint, and to hear, and I know the information is valid, that they've been turning off in the midst of this pandemic, going and turning people's water off at this time, is just very hard to accept. And so those are kind of things that, we have to find a way to tackle. And I just, it takes us back in so many ways to the safety idea. Safe. Are you safe within your community?
Right. And I think go ahead.
Is that for, who is that for? What does that mean? Is that for us? Is that for someone else?
Yeah, I think I was even thinking about this whole term about when we say goodbye to each other, or you say, you end off your conversations instead of saying peace, or you saying I love you. Sometimes it's more like, hey man, be safe. And
safe.
That term is, I think it might become more of a hashtag pretty soon, if we don't coin it ourselves. We said it here first, but that whole thing of being safe is more like, I want to see you tomorrow.
Yeah.
I want to see you healthy. Even as we nod to people as we walk by, whether mask or not having a mask, there's this like smile or this gaze you give each other, like, hey man, we probably wouldn't even talk if we didn't have this COVID thing, but I see you now, and hey man, be safe. I don't know you, but I connect with you, but be safe. And I think within that is almost like, I love you, or I care for you, or hey, I think I see you. Almost the Zulu kind of interaction back and forth, like I see you, kind of salutation, and it's really getting deep. And even when you go to like the BJ's or any of these other markets, when you go into public spaces, you don't even see the people's mouth, but you see those eyes, and those eyes can be very telling about like a familiarity that we're going through. Because you know, you could easily just walk past people, but when you see those eyes, it reminds you that we have a lot more in common. And with my eyes, I can see and understand a little bit more, empathize what you're going through. So sometimes you get the head nod, what's up, man? You know, or you know, young lady, nice to meet you. You know, but it's something. It means something a little bit more now. So I guess my hope is after all this, after everything is over, do we go back still with that? Be safe. Maybe and what would be the response to that? You know,
that's the question indeed. In terms of the whole post-COVID world that we're headed into, what is it going to be like? One hopes, one things I think that a lot of those things that we've been talking about, you know, more positive habits, good things that have been taking place, taking an interest in hobbies, taking an interest in things that one didn't necessarily have time to do, even though they actually should be first on your list. Family, you know, looking in on folks. Have you called certain people? There's people that we all, you know, that I've been finding myself talking to more people that I would not have necessarily expected or guessed that I would talk to, you know, and that can only be a good thing, because maybe a person needed a phone call, you know, and you know, so I think so too. I think, you know, I think in the midst of the picture that, you know, is hard, there's challenges certainly, and there's been some setbacks, but I think I see a story of resistance and under extreme circumstances, one of uplift, one of love, and one that is, you know, just intended right now for survival.
Yeah.
You know what I mean?
Yeah.
So that be safe, you know, it's about, that's what survival is, being safe. Be safe out here and survive.
Yeah, and see you on the other side of this. Yeah, it's like this also this thing of projection of hope. It's like, yeah, be safe so we can see each other when we take this mask off and things like that, man. I mean, that's a whole other conversation right there too, man. But
yeah,
I think I hope, like I said, part of what we want to do with these conversations that you and I are having, and for those who are listening, understand like these are conversations that we have on a regular basis, but we just want to bring it to your doorstep. But that we instill hope, some direction, some resources, but also just opportunity to pause and hear each other. So if anything that we're doing on this podcast right now is like sitting and listening and hearing each other out. And like I said, hopefully, you know, if we ever bring in a guest or anybody else where we can kind of like have this thing happen in a really like triangular kind of way. But once again, this information goes back out to the community. And all we're doing is spreading love. So, yeah, just telling everybody, as you say on the end of everything, like, hey, take this information in and continue to be safe, you know.
Be safe.
Word, man. So with that, I think that's the end of our conversation today. And like I said, I'm Dr. Jarvis Watson.
I'm Dr. Zebulon Maletsky.
And we just thank you for joining us on our first podcast, and we want to see you on the next one that we have coming up pretty soon. So to all that have been listening, to Wendy.
Wendy.
All right. Be safe.
The revolution will not be televised. The revolution will not be televised.